Hello, my name is Shelley Sowers. I'm an instructor with UMA. I currently teach in the MAA MOBS program. I hold degrees in medical assisting, health service administration, nursing, psychology, and also business. Today we are going to talk about the therapeutic response to stressed clients. And all of us at some point, if not every day, will come in contact with clients who are stressed. We may have been a client who was stressed at some point. So I think we can probably relate to a lot of the things that we'll discuss here. And let's begin by discussing what our agenda is for this presentation. We will describe and discuss the different stress theories, differentiate between the terms stress and stressors, list signs and symptoms of normal and dysfunctional stress in each age group, describe ways to decrease stress for each age group, discuss stress and the lifespan, and then discuss stress-related disorders. Let's talk about eustress and distress. Eustress is also known as good stress. And we don't typically think about stress being good, right? But there is a such thing as good stress. And this helps us cope with daily challenges. Pretty much helps us learn how to prepare for the day and all of the challenges that might come about that day. It helps us to feel more energized and alert. And you might notice this. Let's say that you are dealing with a situation that's a bit stressful. In that moment, do you feel tired? Or do you feel less energetic? Or do you feel more energetic? So we typically will feel more energetic and alert during those times. We're able to make judgments and decisions. Examples of a good stress may include staying alert while driving to school or work, bringing tasks to mind that must be done, and assisting others during a crisis. Then we have distress. That's a bad stress. It's considered a danger. It can also lead to pathological changes. Examples of distress may include marriage preparations, divorce proceedings, raising a family, which a lot of us do, on-the-job difficulties, and the serious illness and or death of a family member or close friend. So all of those things, if we see raising a family, that can have a lot of joy, but that can also be really stressful and everything that kind of goes along with it. And that can lead to what's known as distress. Let's go ahead and let's talk now about the different stress theories. Let's talk about Claude Bernard, 19th century French biologist who discovered, and this is really neat, that the body has an internal environment that will constantly change to meet the body's needs. So the body will always consistently seek to maintain what we call homeostasis, which is a constant internal environment, constant correct temperature, blood pressure, pulse, respirations, and everything that we do can affect that, right? If we are under long periods of stress, we can go into general stress syndromes, which affect all of those different factors we just talked about, blood pressure, temperature. So stress can definitely affect homeostasis. If there's too much change, death may result. So if that homeostasis is not there and the body's not in a constant normal internal environment, that can lead to things such as death. We know that patients that are ill are going to be more susceptible. Patients that are maybe are older adults, the aging population, they are going to be more susceptible to stress symptoms. Now, Walter B. Cannon. He was a Harvard physiologist who went a step further than Bernard. Cannon discovered that the body will adjust when change threatens to be too great. So if we see that there's a situation, let's say a blood pressure issue, the body will make changes to try to adjust and compensate for the high blood pressure or even the low blood pressure. Seeks balance, as we mentioned, homeostasis. So very similar to Bernard in the sense of all relating to maintaining that constant internal environment. But this took it one step further and said, well, you know what? When that happens, There's all these other responses that happen to try to get it back to normal. Then we have Dr. Hans Selye. First conceived the theory of non-specific reactions to stress. And he named this theory the general adaptation syndrome. He theorized that the body experiences 4 stages in its response to stress. We have the alarm stage, the fight or flight stage, the exhaustion stage, and then we have that return to normal stage. Let's talk about stressors and stress. Every day we all come in contact with stressors, right? Whether they're positive stressors, like maybe the birth of a baby or getting a new job. That's something we've been wanting for a while. It's a positive stressor, but it's a stressor nonetheless. And then we have negative stressors, such as maybe going through a divorce, challenges with our children, having to keep the house clean, having to cook. We might like to cook, but it's also a stressor. So stressors are anything that causes stress, regardless if it's positive or negative. Internal would be products of emotions, and they can also result, unfortunately, in things like anxiety. External result in external events, and they can involve things like fright. So the 4 categories, let's start with frustrations. Frustrations, these are circumstances that prevent us from doing what we want to do. If you're frustrated, think about a time you were frustrated. And I'm sure it was probably something recently. We all have moments of frustration periodically. During that time, it's really difficult to focus on a task or get things done. Conflicts are incompatibility between 2 important things or objectives equally important to us. Let's just kind of go back to the family dynamic, and let's think about conflicts within our household, maybe siblings. We know that conflict is going to happen with siblings, right? And they're both very important to us, but there may be things that need to happen to come to some kind of compromise to resolve those conflicts. Pressure, this would be a demand of schedule, workload, expectations placed on us by ourselves or others. So let's take going to, finishing your certification or finishing your degree. It's a choice that we may be made, but when we get into the class, there's a lot of demands on us. There's due dates, and there's specific assignments that have to be turned in. So that is a lot of pressure. Even though the end result would be something really positive, it doesn't take away from it's still pressure right now. Then we have fear. This is an emotional reaction to immediate perceived danger, resulting from either something that's real, or it can be an imaginary situation or event. So we can have fear of something that possibly could happen, or we can have a fear that's really imagined. That's not a realistic fear to have. Stress in the lifespan. So let's keep in mind, because all of us at some point will work with most likely all the different age groups, ranging from pediatrics all the way to the elderly population. All age groups experience stress, all age groups. All cultures and genders are subject to stress as well, and how they handle stress are very, very different. So for example, men and women respond very differently to stress. Men often become physically or verbally aggressive and may also use denial as a defense. Whereas women, on the other hand, we often internalize that stress. We might mull over it over and over and just think of it in our minds over and over, trying to figure out what's the next step, And that sometimes can almost be worse, just to sit there and internalize that and hold everything inside and just keep thinking about it and thinking about it. And what does that really do? What does that really do? Besides just lead to more stress, more frustration, more feelings of overwhelmness. Let's talk specifically about stress with infants and toddlers, because we're going to talk about each age group. So infants and toddlers. Infants are totally dependent on others, and they can only express stress through certain things, like crying. Toddlers revert to an infantile behavior when they're stressed. So all of you that have had toddlers or been around toddlers, you might notice that when they're in a stressful situation and they're not really sure how to express that, they may start to act kind of like an infant or a small baby. Therapeutic response is education. Education is key, and we educate regardless of what area we are in, whether you're on the clinical aspect or the administrative aspect, whichever aspect you're working in at that time, we're still doing education. So we would educate to meet infant physical and emotional needs, seek community resources if necessary, and use consistency for toddlers. Consistency is really key. And for all of you that have children that are older, you know, the years of being a parent have probably showed you that, right? Consistency really early on, especially with toddlers, and that's really when it needs to start, needs to be key. Now, what about school age children? So they're going to have a lot of stressful events. That transition from home to school, it's not just stressful on the children, it's also stressful on the parents too. So keep that in mind. They may regress to earlier behavior. So we might see changes start happening, such as bedwetting. That's one that we commonly see. They may start having more behavior issues than what you typically see. So therapeutic responses, we can educate parents and caregivers, empower them. I use that word a lot, empowerment, because when you empower someone, they can take back control. We feel overwhelmed and frustrated a lot when we lose control, even if it's the smallest thing. But if you're empowered and you take that control back, the anxiety and stress will start to diminish. So we educate them and we give them the knowledge to empower them. Then we use terms understandable to a child. We're going to give choices. Choices is important for every age group. But with school age children, they're starting to get a little bit of that independence, right? And they're wanting those choices. Provide encouragement, lots and lots of praise. There's always that reward system. You do XYZ, and then this happens. School age children respond really well to that, but also toddlers do as well. And be honest. We're going to be honest in a tactful way. We're going to be very honest. Now, what about the adolescence? A period of change. The child, yet adult. Social demands, peer pressure. Let's think back to when we were an adolescent. Think about all of those things going on at the same time. Not to mention what's going on in the world around them, right? That has a huge impact on how adolescents respond to school or to their peers or to their parents. Therapeutic responses with the adolescent, we can provide education and community resource material, provide for modesty, address how procedures affect activity or appearance, and then give choices when possible. In some situations, you might not need to give a whole lot of choices. It's just kind of, hey, it's this or it's this. But we do try to give choices when we can. Now, what about the adults? So all of us that are listening today. We have a variety of stressors. I could make a list, all right? And I know you guys probably could too. We could make a list of the different stressors. There's so many effects from that. The boomerang sandwich syndromes where, you do one thing and something else happens. It's kind of like a domino effect almost. Therapeutic responses encourage friends, colleagues to share. If we can get, let's say, a client to open up to us and really share what's going on, that can be huge. And we want to do that by making them feel comfortable, using icebreakers with them. How's your day been going? How's your week? Answer questions, give educational material. Adults really like educational material. And you really just have to kind of see where they are as far as technology, because a lot of the resources we can find on the computer or via our smartphones. Whereas with an older adult, which we'll talk about, they have more challenges with technology. So I know I'm going to have some printed material for them. But with an adult client or an adolescent, I know they probably do well with technology. So my resources are going to be geared more towards something on the phone or something on the computer. Encourage people to talk about their feelings, and that really goes with all age groups, but adults, we have a lot, it's a lot, and we can do it. We can handle it. And we're all here right now. We can handle anything that comes our way, but talking about it and kind of putting some of that on someone else is actually a way to help you get through your problems. Discuss treatment plans and benefits of what a healthy lifestyle entails and what that can do and how that can change many lives and not just our own. Mental health is equally as important as physical health, in some cases more, because when you don't feel mentally healthy, we tend to project that onto others, and it can affect our family, our relationships, our work life. Let's talk about the older adult. So during this time, we see depression quite a bit, and that's something we need to be on the lookout for. Retirement is here, and that could be a good or a bad thing. We think about retirement, we're like, hey, we're retired. But for some people, that may not be a good thing if they haven't saved enough. That might be a really bad thing, but maybe they don't have a choice but to retire. Illness, they face more illnesses at that time. They're facing death. They're losing loved ones. People that they've grown up with their whole lives, they're losing them. And their mind and body may have some deterioration. Retirement can bring multiple losses. Remember that, because they have that interaction, then it's no longer there. But it also might lose, they may lose with financial things, relationships. So some of our therapeutic responses would be to provide educational and resource material, whether that be a resource for mental health, if they have feelings of depression, or if they're experiencing symptoms and signs of depression, or it could be resources about diabetes or hypertension or, whatever the case may be. Use full name. Take time to answer questions and concerns. And I'll tell you guys something. One thing I noticed with the aging population is when they would come to the office, in a lot of cases, I was the only person they were going to visit with that week. And they wanted to talk. And while that might take up some of my time, just sitting there and talking to them changes their week. It changes their day, their life. So for a lot of us, we are that person that they talk with. They may not have a lot of family. So always keep that in mind, that you might be that one person that day that can change that patient's outlook on things. And we foster self-esteem, dignity, sense of self-worth. We give back their independence, and we give them as much independence as we possibly can for as long as we can. And lastly here, stress-related disorders. These are things such as panic attacks, phobias, obsessive compulsive disorder, PTSD. These are all very real things associated with stress. As a healthcare provider, if you experience any of these phobias yourself, or are uncomfortable with clients experiencing these disorders, if it's affecting you in some way, you may find more satisfying work in something towards administrative. That's just something that is good to think about, because over time, the stress can it can affect you. So that's something to think about. There's always the healthcare arena. We always have something, we've got clinical, we've got administrative, and a lot of people do both. They're very versatile in the sense that they can do both. So that's something to think about in case you feel like you need a change in the future. Might be 20, 30 years in the future, but that's always an option. Okay, thank you so much for listening. I hope that this was beneficial.